Hello everyone and welcome back to another video. Today we're going to discuss a common knee condition that can affect many people, especially if you're active, runner's knee. In this video we're going to explore what it is, its causes, common symptoms, and exercises that can help promote healing. Runner's knee, or as it's medically known, patellofemoral pain syndrome, or PFPS, is a condition that involves pain, especially at the front of the knee, where the kneecap or the patella meets the thigh bone or the femur. To understand this condition better, let's take a closer look at the anatomy of the knee. The patella or the kneecap sits in a groove in between two condyles of the femur, the medial and the lateral condyles. It moves in between this groove as the knee bends and straightens, with involvement of the quadriceps tendon and held there with the patellar tendon or ligament. Patellofemoral pain syndrome is often thought to arise when the patella doesn't move smoothly through this groove between the medial and lateral condyles. This can lead to issues such as tendinitis or impingement of structures around or beneath the kneecap, causing pain to the front part of the knee. These conditions, such as tendinitis or impingement, are all grouped under the branch of patellofemoral pain syndrome, or PFPS, but each condition requires a slightly different approach and treatment. So, what causes PFPS? Several factors can play into the development of PFPS, such as muscle imbalance, overuse, poor biomechanics, or a sudden increase in physical activity. We'll delve into a few of these in more detail when we have a look at what exercises might help PFPS. It is worth saying early in this video that getting your knee assessed is a crucial part of recovering from PFPS. Now, some of the common symptoms when suffering from patellofemoral pain syndrome include pain at the front of the knee with prolonged sitting, going up or going downstairs, or engaging in physical activities such as running or jumping. Now let's discuss how you can manage patellofemoral pain syndrome. As with most injuries, during the initial stages, rest and activity modification are quite useful. Avoid activities that worsen the condition, and think about including low-impact exercises as a replacement while you are recovering, such as using a cross trainer or an exercise bike. Physiotherapy is a crucial part to recovery, and in this next section, I want to go through some of the common causes of PFPS in a bit more detail and some exercises that can help combat them. Firstly, a very common issue that we see is a strength imbalance between your inner and outer quadriceps muscles. These are the vastus medialis obliquus, or VMO, and the vastus lateralis, or VL. You can see them here in this image, and you'll notice the obvious size difference between the two muscles. Your vastus medialis sits here on the inside part of the thigh, and your vastus lateralis sits here along the outer portion of the thigh, running all the way up into your hip. These two muscles both have tendons which come down into the patella. When there is a significant strength difference between the two muscles, with the vastus lateralis commonly being the stronger of the two, your patella will inevitably be pulled more laterally or towards the outside compared to the force coming from the vastus medialis. This will often make the patella track a little bit more laterally than we'd like, which can lead to the development of PFPS. To address this, we'll want to perform an exercise to target the VMO. The first exercise is called inner range quads and can be done sitting on the edge of a chair or a bed. Use your index finger to press against the medial or inside border of your patella. Then contract your quads, straightening your knee, and imagine pushing your patella or kneecap towards your index finger as you do so. This will trick the brain into firing the VMO as you think about pushing your kneecap inwards. Perform 10 repetitions for 3 sets. In addition to this exercise, your physiotherapist can also help encourage VMO activation by taping the patella with a small amount of medial glide. Performing exercises with the tape on can help promote VMO activation and retrain balanced quadriceps use. Another cause of PFPS is weakness in the hip muscles. If there is weakness around the hip, the body can force more load into the knee as a result, causing overuse injuries. We generally test this by performing a single leg stand and looking for something known as a Trendelenburg sign, which is the dropping of one side of the pelvis while standing on one leg. This usually indicates weakness in the gluteus medius muscles of the standing leg. To train these muscles, we can perform 2 exercises while lying on our side. For the first exercise, lie with the weaker hip up, keeping a straight leg. Bring it backwards and hold it there. You should feel the upper glute muscles working to keep your leg in this position. Keep it there for 2 to 3 seconds before bringing it back to your side, and then repeat. Work your way up to being able to hold it for 5 seconds. Repeat for 10 repetitions for 3 sets. To make this exercise a little bit more difficult, you can add an upward lift of the leg instead of just holding it flat. The second exercise to help train your hip is to perform clamshells. This is done while lying on your side with your knees slightly bent and feet touching. From this position, open up your knees while staying directly on your side without rolling your body. Try not to let your body roll backwards as you perform this, as you won't be able to engage your hip muscles properly. To make this more difficult, you can add a resistance band to the motion, placing it just above your knees. Perform 10 repetitions for 3 sets. Our last 2 exercises will target the other muscle groups that help control and move your knee, your hamstrings and your calves. Within the calf muscles, we're targeting specifically the soleus muscle, which is commonly neglected in training. Weakness in either of these muscle groups will contribute to muscle imbalance and excess load in the knee during exercise. If you have seen some of my other videos, you might have an idea of how to train your hamstring and soleus muscles already. But in this video, I want to share some exercises that we would give during early rehabilitation. If you want a harder variation of these exercises, I'll leave a link to my other videos a little bit later. To train your soleus muscle, we generally want to perform a calf raise with your knee slightly bent. This can, however, be quite painful to do if you're suffering from PFPS. So instead of performing this in standing, we'll do this exercise in sitting. You can do so by sitting on the edge of a chair or a bed with both feet touching the ground. Then push your heels off the ground to engage your soleus, and then lower them back down. You can gradually increase the difficulty of this exercise by leaning your weight forward onto your knees through your arms, or by placing some weights or a weighted bag on top of your knees. You can perform this until you are able to do the standing version of this exercise, which you can find here. To perform a gentle hamstring exercise, you'll want to lie on your front. The motion is simply bending the affected knee as far as you are able. This is generally not too challenging, as there is little resistance to this motion. To make this a little bit more difficult, we can use the other leg to add some resistance to the movement. As you pull up your foot on the injured side, you can use the uninjured foot to push down and add some resistance to that movement. Add only as much force as you are able to handle without any pain, and gradually increase the load as you improve. Once these are easy to do, you might want to progress onto harder hamstring exercises, which you can find here in this video. And that wraps up our video on runner's knee or patellofemoral pain syndrome. We've gone through some of the common causes that we would see in the clinic and some common starting exercises that will help address those causes. Remember, it is important to consult with a healthcare professional if you are suffering from knee pain for an accurate diagnosis and a personalized treatment plan. With the right care and exercises, you can manage the pain and regain the strength and function of your knee. If you've enjoyed this video or found the information helpful, please hit that like button and leave me a comment down below so that YouTube can recommend this to more people. And if you haven't already, subscribe to get notified on when another video releases to get more tips on looking after your injuries, health, and body. Thanks so much for watching, and if you are enjoying my content, maybe you'd like to check out this video as well.